Sultan bin Abdulaziz Humanitarian City, Saudi Arabia. He will be the chair of day 1, and it would be my pleasure to introduce him.
I thought it is my slot.
Yes, doctor, I'm introducing chair of the day.
Okay.
And I would like to introduce him. Dr. Majid has completed his PhD in Occupational Rehabilitation Psychology from Wollongong University in 2015 and completed his Master's in Occupational Counseling from Wollongong University in 2010. He is working as Vocational Rehabilitation Counselor in Sultan bin Abdulaziz Humanitarian City, Kingdom of Saudi Arabia, and the Department of Rehabilitation. His research focus is on the cancer and vocational development of the young adults, including young adults with disabilities. When not working, Majid can be found trying to create delicious meals with partners, Nora, and bringing their Snowy cat with treats in exchange for snuggling. Thank you.
Well, hi, everyone.
Hello, Dr. Majid.
It's a pleasure being here, and yeah, the Snowy says hi. Dr. Shilpa, no one can steal your slide from you.
Sorry, thank you.
Nobody can dare to do it. Anyway, our next speaker, and I'm honored to mention Dr. Shilpa, and correct me if I'm wrong, spell your family name wrong. It's Jasubhai.
It's Jasubhai, yeah.
Jasubhai.
Yeah.
It's a pleasure, doctor. He's
Thank
a
you.
consultant clinical psychologist and independent researcher who is currently affiliated with Zedius, Shelby, and AIMS hospitals, while also consulting to Sandesh and MICA in Ahmedabad, India. She has been practicing in the field for over 15 years and has completed her doctorate in 2007. Since then, she has actively deepened her knowledge in the field, getting certified in brain gym, optimal learning, vision circle, whole brain learning, educational psychology in depth, touch for health, neuro-linguistics, programming, hypnotherapy, art therapy, emotional freedom technique, quantum focusing, healing, affirmation, Reiki, and essential of CBT and access consequences. That's rich, doctor, I give you that. She has been contributing to the development of the field with several published papers and being a speaker in India and globally. Recently, she received an International Leadership Award as an innovative researcher from RULA in association with United World Council and United Medical Council, and under the title of Remarkable, actually, the award's name was the Remarkable Research Award of the Year under ISSN Golden Research Prize. The title the doctor will discuss today will be the effect of increased physiological coherence on stress, anxiety, depression, and feeling state in young Indian adults. Go ahead, doctor.
Thank you.
Pleasure.
Hello, everyone. Thank you, first of all, Confrontiers, for giving me the opportunity to share my work on this platform today. Today's topic is effect of increased psychophysiological coherence on stress, anxiety, depression, and feeling state in young adults. One second. My introduction was already given, so I think I should not repeat and waste all of your time. This year, 2020, has been a very challenging year for everyone. It has created a lot of insecurities and uncertainties in people worldwide. Stress, anxiety, overwhelm, frustration have become part of everyday for everyone. According to a survey done in August 2020 by International Labour Organization, 50% of young population got affected by mental health due to COVID lockdown, and 1 in 2 youngsters were prone to experiencing stress, anxiety, and depression. Working from home, extended working hours, lack of socialization, and additional responsibilities at home made many experience symptoms of burnout, stress, anxiety, and depression. In last 6 months, I have received number of calls from students who are experiencing stress, anxiety, panic attacks, and etc. So I decided to conduct a small study, and as I'm attached to university, like MICA is a university called Mundra Institute of Communication, Ahmedabad. So there were a lot of students who were experiencing these symptoms. So I could easily get the participants. And my research objective was to investigate the effect of increased psychophysiological coherence on stress, anxiety, depression, and feeling state in Indian young adults. Another topic, I included was study the effect of coherence technique on heart rhythm pattern, stress, anxiety, depression, and feeling state in Indian young adults. The technique that I used to reduce stress and anxiety, depression, and improve feeling state and psychophysiological coherence was the quick coherence technique. There was not much data, past research work available on the same topic, but related research work was available. Appleton, the H.L. Ginsberg and Hartman observed positive link between depression, anxiety, heart rate variability, and heart coherence. Basically, heart rhythms activity indicate different emotional state. Study by Bradley and showed positive association between anxiety, increased psychophysiological coherence, and improved testing performance. Even Jorina Alberts and Roland McCarthy, in a study on HeartMath approach to self-regulation and psychosocial well-being, concluded that change in the heart rhythm plays an important role in enabling higher cognitive function, creating emotional flexibility, and helping social connectedness. HeartMath training program helps increase the heart and brain coherence. Lucy Edgefield et al. In a study influence of HeartMath training program on physiological and psychological variables received positive results with HeartMath training. S.D. Edward, Jared R. et al., Kunjal Trivedi et al. Reported positive effect of controlled breathing technique on feeling state and psychophysiological coherence. McCarthy R. et al. Concluded that heart influences brain's cognitive and neurological functions. Breathing exercises help reduce stress, anxiety, depression, and improve psychophysiological coherence. In psychology, stress is basically a feeling of pain, strain or pressure. Anxiety is a feeling of worry or having worried thoughts. Depression is a state of feeling hopeless, sad, having no interest in things, etc. Basically, dictionary defines stress as a state of mental or emotional strain. Symptoms of generalized anxiety, according to the DSM-5, our excessive anxiety, worry occurs often than not for at least 6 months. Difficulty to control worry and may be associated with physical or cognitive systems like difficulty concentrating, restlessness, irritability, sleep disturbance, etc. According to the DSM-5, depression symptoms are mainly like having mild or severe sadness or loss of interest, change in appetite, change in sleep, loss of energy, feeling of worthlessness, suicidal thoughts, difficulty concentrating, and symptoms that must be at least for 2 weeks. Psychophysiological coherence. According to Rollin McCart, coherence is an optimal physiological state when the heart, mind, and emotions are in alignment. Coherence means the synchronization of our physical, mental, and emotional system. According to HeartMath Institute, creating constant positive emotions allows body-wide change, which is scientifically measurable state. This state is called psychophysiological coherence. It can be measured by our heart rhythm pattern. Our feelings and emotional stress affect our heart rhythm pattern and make it appear erratic and irregular. The more balanced and smooth they are, the more in sync and coherent we are. Quote by HeartMath Institute: the synchronization of our physical, mental, and emotional systems can be measured by our heart rhythm patterns. The more balanced and smooth they are, the more in sync and coherence we are. Stress levels recede, energy levels increase, our brain and the heart-brain work together. It is a state of optimal clarity, perception, and performance. What is this system? Basically, HeartMath system. MWIF system was developed by Doc Shilray, and it is based on years of scientific research on the psychophysiological stress, emotions, and the interactions between the heart and the brain. The HeartMath system uses self-regulation techniques to release stress, improve resilience, and health. It accurately measures your heart rhythm and shows when you are in coherence. It is well documented that positive emotional state and re-experiencing the positive emotional memory have a strong effect on physical, mental, and emotional well-being. The neural pathways and the activities of the heart have a strong influence on brain function and emotions. Quick coherence technique uses all these factors to create a state of coherence and state shift in well-being. Along with rhythmic breathing, focusing on heartfelt positive emotion is the key element of the HeartMath technique. Heart rate variability. Heart rate variability is a measure of beat-to-beat changes in the heart rate. It is an indicator of physiological and mental resilience that shows our ability to cope effectively to stress and environmental demands. Our breathing patterns, physical exercises, thoughts influence our heart rate variability. Heart rate variability pattern, that is heart rhythm pattern. According to HeartMath Institute, our feelings and emotions directly affect our heart rhythm pattern. Varying heart rate is plotted over a time, and the overall plot of the waveform is called the heart rhythm pattern. Emotional stress gives rise to irregular, erratic heart rhythm patterns. You can see here that when the person was experiencing frustration, anxiety, worry, irritation, like all negative emotions, the heart rhythm pattern was absolutely erratic. Once the person became calm and experienced the positive emotions, the heart rhythm pattern became more synchronized and smooth. The role of breathing. Breathing is something you do automatically. And effect of deep breathing on mind and body and in reducing anxiety, depression, stress is well known, and it has been practiced in yoga worldwide. Breathing was an important aspect of the study because it was the first step of the technique participants used to self-regulate their feeling state. When a person is in stress hormones are secreted and it may cause speedy breathing, increased pulse, or blood pressure. Deep breathing can help reverse these symptoms and relax the body. It activates the parasympathetic nervous system, which reverses the stress response in the body. According to Jareth R. et al. On self-regulating of breathing as a primary treatment of anxiety, concluded that breathing technique could be used as an initial treatment for stress, anxiety, depression, or any other emotional disorders. My null hypothesis was there is no significant effect of increased psychophysiological coherence on stress, anxiety, depression, and feeling state post-intervention in Indian young adults. Alternate hypothesis was there is a significant effect of increased psychophysiological coherence on stress, anxiety, depression, and feeling state post-intervention in Indian young adults. Materials were used, like consent form was given, then demographic information was collected. I used DAS 21 for collecting data on depression, anxiety, and stress. The MWIS system was used to train them and give them the breathing, like a quick coherence technique was used, and their psychophysiological coherence was recorded using MWIS system. And feeling state was recorded on also. Method used was this randomly they were selected. 9 subjects were selected between the age group of 22 and 28. They were asked to sign the consent form and demographic form. After that, they were assessed for stress, anxiety, depression, and feeling state using the DAS-21 and feeling state form. Then their psychophysiological coherence was recorded, heart rate was recorded. They were given 6 weeks of quick coherence training sessions, and they were given whole plan too. Then after the 6 weeks, they were again assessed for stress, anxiety, depression, feeling state, psychophysiological coherence, and their heart rate was recorded. In each session, at the beginning of each session, participants were asked to rate their feeling state, that is anger, anxiety, sadness, happiness, calmness. Basically, I used only 4: anger, anxiety, anger, sadness, happiness, and calmness. And before and after each session, and the scale was used of 1 to 10. Quick coherence technique was taught to them, and in each session, training was given using HeartMath Coherence Coach, and quick coherence technique was. So as you see, in the training, they were focusing on the ball here, and when the ball is going down, they were supposed to exhale. And the moment it starts going up, they were asked to inhale, and then again exhale as it comes down, inhale and exhale. And while doing this, they were asked to focus on the heart. And the home plan was given, like, heart focus breathing exercise, affirmation, and cognitive restructuring was given to them as a home plan. The quick coherence technique. What is quick coherent technique that I used? The quick coherent technique is a simple technique that uses the power of the heart and breathing to balance thoughts and emotions. It puts your heart in more coherent mode and has a carryover effect. So you feel more connected and centered. Positive emotions and positive feelings activate heart coherence. So the first step is heart focus breathing. They were asked to focus their attention. Once they started breathing, they were asked to focus their attention on the area of the heart, imagining that they are breathing in, that breath is flowing in and out of their heart, and they were breathing is slower and deeper than usual. Then they were asked to activate the feelings and make they were asked to make a sincere effort to re-experience their positive feeling, when they felt some loved one, remembering some loved one when they loved someone, or any other incident, and they were asked to concentrate on that and re-experience those feelings at that moment. So by loving a pet, or special any accomplishment or something, and focusing on feeling of calm and ease as you continue. They were asked to continue breathing. This technique was continued for 5 minutes. A quick coherence technique helps you create a coherent state, offering access to your hearts and intelligence. The results were after the 6 sessions, the quick coherence training improved stress, anxiety, depression, and psychophysiological coherence and heart rate. It significantly improved this. And before the training, the stress, anxiety was in a severe range, and anxiety and depression were in the range of moderate. Coherence was low and heart rate was high. So after the 6 weeks of training, like twice a week, training, then the stress level came down to moderate, and anxiety and depression were in the range of mild. Coherence also increased and heart rate was reduced. Findings are highly consistent with the prior studies that confirmed that heart rate variability parameter value correlated with changes in the severity of stress, anxiety, depression symptoms such as Ginsburg, Jorina, Rollin, McCretty, and Hartman. Their feeling state was also, like, there was significant improvement in the feeling state also. The anger, which was at 7.33, came down to 4, 6.33. The sadness came down to 4. Happiness was on 4, which increased to 6.67. Calmness was 3.83, which increased to 7. And results are highly consistent with prior studies that confirm the positive emotions lead to alteration in heart rate variability, such as apple hands, etc. And even results supported the case study conducted by Wellness Space, where they concluded that 10 minutes of chanting increased the coherence and helped reinforcement positive emotions. These basically, all these, the breathing technique, chanting technique, they're now are proven to reduce the stress and anxiety instantly. One of the subject who was 25-year-old female had severe stress, moderate anxiety, depression, and her coherence was 1.2 and heart rate was 98 pre-intervention. You can see that her heart rate variability pattern is so erratic. And low coherence basically indicate that body is under stress. And as you can see from the image, her heart rhythm was erratic. She showed noticeable improvement after 6 sessions. Her coherence went to 3.6, heart rate also decreased to 84. And her stress score came in the moderate range, and anxiety and depression were in mild range. Results are consistent with the past studies such as Jarrett et al. And S.D. Edward, where the results were similar. Basically, the limitation is my sample size was too small, and the period of training was also only 6 sessions. And further research on larger sample and doing it for a more better, more extended period would really help. Thank you. Any questions? I'm ready to take.
Thank you for your talk, Doctor. Any questions for Dr. Shilpa Jasubhai? Any questions for Dr. Shilpa Jasubhai?
I don't think so. That I have any question.
Would I ask some questions?
Yes.
Yeah.
Yes, yes, please go ahead.
Can I ask questions now?
Yeah, you can.
Yes,
You
yes.
can.
Okay.
You can.
Have you tried to analyze and compare this research with other countries, or did you research or say something that in other countries what happened about that or not? Maybe I want to know that your research area or data was completely a scope in just a limited place, or no, you try to spur or extend it in other parts of the world too?
No, 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 this was only in India, in Ahmedabad, where I work. And it would be nice to work, collaborate, and work in different countries. And basically, this is it's a program called HeartMath system. So you have to install it on the laptop, and like it's a recording, it's a earlobe thing that you attach to your ear, and you record your heart rhythm pattern. And along with that time you do the after recording you do the training program with quick heart rate technique, and teach them the heart focus breathing. So even if you don't do it on a computer, you can teach them the heart focus breathing technique, which they can do anywhere. And
Yeah.
that has also shown me a lot of positive results, because I deal with a lot of students and clients with
Excuse me for discouraging your talking. Okay, would you believe that this technique can be spread in some other parts of the world too? I mean, for example, we are from Iran, and we wanted to use this technique for our patients or somebody that they want to use it. Okay, could
you
you
can
give us?
use it. So you need to buy the program. This
Yeah,
is available in USA.
yeah,
So you can buy this HeartMath program from them,
yeah.
and you can go to get it installed. So you can buy the program, and then you can work with those patients in Iran.
Okay, thank you so much, and that was very
Yes.
great. Okay,
Thank
I
you.
appreciate you and your colleagues a lot. Thank you so much.
Thank you. Thank you.
Have a good time.
Thank you, Dr. Ibrahim.